So here are some couple of cases for you. First one, this was a CO2 resurfacing case that caused contracture scarring, hypertrophic scarring around the mouth, and this was the extent to which she could open her mouth at the time that she saw me initially. So there was redness, hypertrophic scarring, and texture change in the contraction of the mouth. What we did was started with pulsed dye laser to help with the erythema, and then did ablative fractional resurfacing. We did some CO2, we did some erbium, and then did laser-assisted drug delivery. With Kenalog, we also did 5-FU as well. And this is the before and after in terms of her ability to open her mouth. So this is really important. It's very important to understand that when you have these contracture scars and there are different areas that you can have this, that you can really change someone's life with lasers in that way, and it's a very gratifying thing to do. This before and after, still needs some work, but she's a lot better than where she started and certainly has a lot more mobility. I don't think we have sound, so I'll just keep going.
I had to cut my food up, and I was just in a mentally bad spot. And it's been a long road, but I couldn't be happier. It's wonderful.
So you can hear the New England accent there as well.
Hanging in there?
This, I just want to show another example of laser-assisted drug delivery. There's a fractional CO2 laser, then 5-FU and Kenalog. And this is what you can get in terms of improvement when you treat these scars. Can really change, again, mobility was a big thing there on the wrist. That was a burn that had nothing to do with lasers, just for demonstration purposes. So this case is mine, and this is a dramatic one. It's a 40-year-old female, comes in like typical, like slam dunk, 1927 nanometer fractional laser for dermatoheliosis, completely healthy, undergoes treatment at conservative settings. I actually gave her prophylactic valacyclovir for the treatment. It was, if you know this non-CME?
Non-CME.
Okay, so yes, this was the Fraxel Dual, 10 millijoules, treatment level 4, total energy of 1.24. It's just, again, straight up the middle. And then 36 hours later, she calls my fellow, and it's Sunday morning, and she says, like, I had some bumps overnight. You know, is this normal? And the fellow said, why don't we just see her tomorrow morning? I was like, I don't know. Let's bring her and see what's going on. And then this is like an hour or two later. This is what we see, right? 5 hours. Lakes of pus. I walk in the room, I'm like, this is a catastrophe. She said that she felt like she had the flu, aches all over her body. She felt like she had a fever. So I went over to the CVS and got a thermometer because we don't have one in the laser center. Her temperature is 103.3. Her blood pressure is 90/40. Her heart rate's 110. So she's sick. So what did we do? Tissue swabs, HSV culture, DFA, KOH prep, which was negative, and we did a gram stain and rushed it to the MGH microlab, which is whatever, a 5-minute jog by my pace. And they called back pretty quickly and said gram-positive cocci clusters, looks like staph. So as soon as we did the cultures, we put her on several medications, including Doxy, Cipro, diflucan in case that it was yeast, and then hydration, which consisted of giving her a lot of water to drink. We brought her to the MGH for observation. They gave her IV Vanco, hydration. We did dilute vinegar soaks in the ER, and she felt better within a few hours. As quickly as it got bad, it got better. And this is her day 1, and it was methicillin-sensitive Staph aureus. And here she is day 2, day 3, and there she is day 7, and we published that in our society's journal a few years back, and she actually has come back for treatment. It was years, but she did. Next complication, 65-year-old female comes to me with sun damage. I recommended, again, the 1927 nanometer thulium laser, told her to expect 4 to 7 days of redness, swelling, and peeling. She grew up in Florida, had been on, so she had a lot of sun exposure and had been on steroids for years, and she had numerous telangiectasias, poor skin texture and tone, but she really wants to get rid of the dermatohiliosis. So I begin to treat her, and this is what I see immediately. Every time I move the laser, it turns purpuric. So I stopped and I thought, all right, what's going on here? And, you know, I noted the purpura, and I'd never seen it before. Other than I'd seen pinpoint bleeding with the original Fraxel device. Occasionally you see it. And I thought about it, and it made sense to me. Basically, so what I said to her was, I have some good news and some bad news. You're going to look really bad for like a week, but you're going to get a really good improvement. Basically, she had really atrophic skin from all the sun damage she had, her age, and then from the steroids for all those years. So every time the laser at 200 microns was going through, was pinging the vessels, and they were turning purpuric, and that's exactly what happened. And there she is afterwards. I don't have a before because I wasn't anticipating this was, I couldn't find it in the records, but just something, that one was fine. That was all about explaining it to the patient, and luckily this was a patient who wasn't upset when her face was confluent purpura, that's just good luck. Most patients would be very upset with you. And there it is clearing. This was IPL at a med spa in New Hampshire. Patient comes in, she has the striping, and you know, looks terrible, and you know, she's crying, and you know, what can you do to help me? So what did we do? Do nothing, stay out of the sun, no topicals, give it time. And we said, come back in 6 months. It's a great before and after. It makes me look like a really good laser surgeon, but it was hypopigmentation. It wasn't that strong, and it completely cleared. So don't just stand there, do nothing. Sometimes is the best means of helping. So in the case of a complication, intervene immediately, get the advice of your colleagues. I do that all the time. Tom's on speed dial for me. Make sure the patient follows your treatment plan. Had she not followed the treatment plan earlier in some of those other cases, there would have been horrific consequences, and you have to get lucky too. So I think the most important thing is, this is my legal background coming in a little bit, don't abandon your patient, talk to them, tell them everything, you know, be upfront and honest with them, because in my experience, the thing that makes these things worse is they start going to other doctors who know nothing about lasers and start giving them Silvadene and things like that, and things will get much worse. The other thing is your odds of being sued go way up if they feel that they've been abandoned, and rightly so. So thank you.